afternoon, good evening. Whichever time or time zone you are viewing from, welcome. My name is Dr. Peace Nkemdele Naji. I'm a member of Nigeria Medical Association, Enugu State. This season, we elect the state officials of the association. And now, today, I'll be introducing to us one of the chairmanship aspirants by the name Dr. JOT Onyia. Dr. JOT Onyia.
My revered medical elders, very respected senior colleagues, distinguished colleagues, and my amiable junior colleagues, good day. My name is Dr. JOT Onyia, and today I present myself to serve the Nigeria Medical Association Enugu State Chapter in the capacity of chairman. I will take us through my vision for NMA Enugu State. And this vision and achievements are the things I want to drive with passion in the next 2 years. My 4-point agenda in my manifesto will be, first, strengthening the NMA Enugu State as an association. Secondly, will be the welfare of our members. Thirdly, will be how to improve the healthcare delivery in Enugu State. And lastly, will be external collaboration. First, to strengthen the association, I have noticed that one of the major problems we have in NMA, Enugu State today, is apathy. Our members are not interested in the association because they feel that the association does not impact on them. I will first of all tackle this apathy. And how I'll do that will be by activating the zones. If you remember, I was the pioneer chairman of NMA Enugu West Zone, and that was when I laid the solid foundation that guided the zone to its level of vibrancy that is enjoying today. If I become the chairman, I will also activate the other 2 zones and make them vibrant. We will reinvigorate interest of our members in the zones and also in the states by introducing subtle competition amongst the zones. We'll also take some of our programs to the zonal level so that the members there will participate, own these projects, and develop interest in the activities of NMA. Some of these activities will be: 1, medical outreach. I'll bring my experience, having served as the community service chair of Rotary International District 9142, and also the National Technical Director of Rotary Family Health Day. This is a Rotary Action Group that deals with medical outreach to communities that cannot afford proper health care. And also having served as the Vice President of my town union and learning how the communities function. We will do needs assessments of the communities in our zones, and we will collaborate with these organizations that I mentioned to organize very robust medical outreaches in the zones. By doing this, we will stimulate interest of our members in these zones to participate in this program, and at the same time give back to the society. Because most times NMA is heard of when we go on strike for our welfare or remuneration. But this time we'll be giving back to the society, again to change the image of the association. I will also organize intra-zonal sports competition that will unite us and motivate our young members to participate therein. I would also create subtle competitions amongst the zones, like the CMEs, to know the zone with the highest number of CMEs in a particular year. I would also, and very importantly, challenge the zones to go back to their zones, to the hinterlands, to stimulate their members, and then we will judge them based on the zone that we're able to bring in more members to the fold. And at the end of the year, maybe during our Physicians Week, we will appreciate such zones. We will review our constitution and uphold the constitution of our association. We will also run a transparent, effective, and efficient and all-inclusive government during our tenure. We'll be very accessible. Problems of our members will be given quick attention. There is need to reorientate our members to develop more passion for the profession and seek to improve the standard of care of our patients. This we will do by organizing colloquium maybe twice every year so that both the medical elders, the younger colleagues, and every member of our association will come together to discuss this problem. Besides this, we are going to also discuss via that colloquia issues like working relationship, mentorship, and our welfare. We will also visit the management of the various institutions in the state to see how to inculcate this habit or tradition into our members. Also very importantly is that we're going to develop bills and proposals which we will present to the state government so as to improve our healthcare delivery in the state. We will improve the image of NMA, Enugu State, by giving back to the society. And very importantly, we will begin the building of a befitting secretariat for our dear association. This we will do by collaboration with the government, a non-governmental organization, philanthropists, and from our members. I think building a secretariat for our dear association is long overdue, and it will not be a source of campaign after now because we will begin to build that secretariat. The welfare of our members will get paramount attention. This is because the lack of attention to the welfare of our members is one of the primary causes for the apathy that we see in NMA, Enugu State today. Members suffer from excessive taxation, especially those in the private practice. You have different government agencies disturb them from state government and from local governments. This needs to be properly addressed. Even our colleagues in UNTH suffer from excessive taxation by the name of Peter. This matter has not been given adequate attention by the NMA. If I come in as chairman, it will be in the front burner. We wouldn't even mind calling an emergency meeting to discuss the taxation problems that doctors in this Enugu State suffer. And we will bring it to an end. It will be addressed adequately. Also, we have our young doctors, the house officers, come in every year. Most of them come in, they don't know their left from their right. Under my watch, within the first 6 weeks of starting housemanship, we will organize a career-oriented symposium for them to put them through what they would go through as house officers, their responsibilities, their duties, and also to enshrine that culture of standard of practice and to develop passion for the profession. We would also talk to them about what the career track they could follow at the end of their housemanship. These young colleagues need to be taken care of. They need to be pampered even as we put them, teach them, and pull them through the track of development in the medical profession. We will organize various social activities for them. They will need to feel the impact of NMA, not only during elections or during Physicians Week. We are going to create a committee that will be dedicated to the young doctors. Every year, both UNTH and Parkland churn out large number of doctors, and most of them do not have placements where they could do their housemanship. Some stay as much as 2 years before they get a place to do house job. Under my watch, I will approach the government and the mission hospital and see a way to open up more centers for doctors to do their housemanship. I've even already started something in that regard. Very recently, I approached the Reverend Sister in charge of one of the mission hospitals, and she told me that what is keeping them from using that center as a center for housemanship is that the MDCN has asked for ₦1 million for their accreditation fee. If I come in as chairman, this matter will be raised on the next floor of NMA National, because we will approach MDCN through the national to reduce this fee. And when we come home, we will assist these centers to do all they could to ensure that those centers are opened up for housemanship. would also meet the state government to tell them the importance of using the general hospitals for housemanship, because the consultants will begin to work in those centers, and it will also improve the delivery of healthcare to the patients that come from the rural areas. Our elders deserve their due and their respect. Under my watch as chairman, I will organize the Elders Forum that will meet from time to time to discuss the critical issues that we have in NMA, Enugu State. And this forum, this meeting, will end with the Elders Night, where we will create fund for them. Our doctors in the local government employ are abysmally remunerated, and their working conditions are so poor. If we come in, we'll also bring this up to the front burner, where we'll address both their welfare and their remuneration, and give back the pride of place that they should have, even as they work in the local government. We're in the face of pandemic, coronavirus pandemic right now, and some of our members are struck with this virus. Unfortunately, NMA has not thought it wise to protect our members by providing PPEs to our members like it's been done in some states. We left it in the hands of the government and management to do that. NMA must learn to give back to its members and adequately care for them. So under my watch, in the face of any pandemic or epidemic, I will provide PPEs for our members, in addition to opening a dedicated line to our members who are distressed from the epidemic, be it financially, physically, emotionally, and otherwise. This is in addition to providing day-to-day, up-to-date knowledge on the management and treatment of that disease condition. I have observed that most of our departments, both in UNTH and Parkland, lack accreditation or have just partial accreditation for those departments. NMA will have to stand up to its responsibility. Sometimes what is needed to gain full accreditations, they are not much. But the fact is that NMA has not asked questions. Just asking management of this institution questions might stimulate them to do the needful and provide what is required for the departments to get accreditation. Whereas what is required is not so expensive or so much for us to spend on. And if NMA can afford it, we can begin to give back to our members. It's not only for NMA to collect our dues, NMA should also give back to its members by ensuring that our departments are fully accredited. We will ensure that management of these institutions do the needful to give accreditation, to gain accreditation for the various departments in NMA Enugu State. The third strategic agenda will be to improve healthcare delivery in Enugu State. First, we will ensure that doctors in the local government employ receive continuing medical education from NMA. This will educate them and help them to deliver better healthcare to the patients in the rural area. Also, we'll partner with the Ministry of Health to enlist consultants to the various general hospitals and health centers, where they will bring their experience to bear to ensure that better healthcare is delivered in those rural areas. Very importantly, we will propose bills to the Enugu State House of Assembly that would improve the healthcare delivery in Enugu State, and also ensure that the healthcare reform process is given accelerated implementation. The last strategic agenda will be external collaboration. We will actively engage and partner with non-governmental organizations, pharmaceutical companies, the government, and other organizations to support our projects. For instance, I was the immediate past International Service Chair of Rotary International, and this office is responsible for the grant-funded project that is brought into the district. NMA Enugu State will partner with Rotary to ensure that big projects, grant-funded projects, are done in Enugu State, with NMA Enugu State being the local partner. Projects like dialysis center, vocational training team, or research laboratory can be built in NMA Enugu State through collaboration with Rotary International. My experience will be brought to bear in this respect. Also, the NMA Enugu State will play a very active role in the national politics of NMA in the coming dispensation. I will ensure that the Secretariat of NMA National is brought to Enugu State. So I urge all our members who have interest in being president or secretary to warm up and dust their shoes to contest these positions, because we will bring back the Secretariat to Enugu State. The advantage of this is that we expose more people to the NMA national politics, and also our individual and collective challenges or problems will be given very quick attention. Dear respected colleagues, having presented my manifesto to you, you would observe one thing. I have not just said that I will do this or that and that, but I put us through on how I will achieve these. These are very tangible things that can be achieved. All we need is the will to do it, and I have that will. I'll bring my experience and capacity to bear. I'll bring in my capability, my contacts, and my reach to ensure that these tangible things that I've enumerated are achieved within the next 2 years. I want to be held responsible for all I have delivered in this manifesto. With the passion and zeal which I have for service, and with your unflinching support, and of course with the grace of God, I am very confident that all we have enumerated will be achieved in the next 2 years. And for all our members who have played one role or the other to support me to achieving this mandate of chairmanship of NMA Enugu State, you will look back after 2 years and you'll be proud that you did. I still remain Dr. JOT Onyia. Your vote will make all the difference in NMA Enugu State for the next 2 years. Please vote for me. Thank you.
Wow, what a compelling manifesto by the aspirant, Dr. JOT Onyia. So come the 6th of August, let us all come in mass and vote him into the office of the chairman. I'm going to vote. I'm expecting you to vote. Thank you so much. We'll see you some other time. Thank you.
Thank you.